CRNA scope of practice state to state is undoubtedly the most misunderstood topic of all time when it comes to the nurse anesthesiology profession. By law, your ability to give anesthesia as a CRNA actually comes from your nursing license and passing the NB CRNA NCE exam. When it comes to cases in the operating room and giving care that pertains to anesthesia, as well as labor and delivery floors and surgery centers and GI centers, yada, yada, you can do all of the things in New York State that you can do in every other state. There is not a single limitation on your license. Now, at the same time, what's also true is that New York State and Pennsylvania are the only two states in the entire country where we are not considered advanced practice registered nurses, even though we have a minimum of 4 times the clinical training of nurse practitioners. And that's not a knock against nurse practitioners, by the way. It's just like the hour-to-hour minimum difference. Like, it just is what it is. Anyway, so where you might see scope of practice differences pertains to out of anesthesia services. There are a handful of states where your APRN license gives you prescriptive authority outside of the anesthesia realm. I believe Idaho and New Hampshire are 2 states like that. So when it comes to outpatient prescribing for like ketamine clinics or like pain management services, in certain states, your CRNA license will cover all that. In other states, you would need to also become certified as a nurse practitioner in order to be able to do that outpatient. But there are absolutely CRNAs giving anesthesia in New York State, in New York City, in Manhattan, independently, every single day. Are you going to see it in a large academic medical center? No. You also don't really see anyone giving anesthesia solo in those centers. There's training. These are big cases that generally require a lot of hands. If you go down the road to a little surgery center or a plastic surgeon's office, there are people giving solo anesthesia all the time. So in all 50 states, big academic center, you're always gonna see a certain type of model of care. Mid-size model, typically loose ratios, mixed staffing models, really just depends on the needs of the facility. And teeny tiny facility, they're gonna have less need for these tight ratios and all this supervision and all of these different billing requirements. You're gonna see a lot more independent anesthesia. So get the state thing out of your head. Just like let it go. Just stop it. If you want to learn more about it, go to the Confident Care Academy YouTube channel. We also have the episodes streaming on Spotify. The episode is titled, "What Kind of Cases Do CRNAs Really Give Anesthesia For?" And it dives deep into this if you want to know more details.